Hey, Chuck here for Retirement Ain't Easy. And today, this morning, I got a notice in my app from my surgeon that it's been 30 days since my surgery. And so they were checking on my goals, how I was getting towards my goals. Well, I haven't accomplished the goals. If you watch the other video, I haven't walked around the block for a mile. I haven't rode a bicycle. I haven't done any of those. So I'm still on the cane. I have moved from the walker to the cane and walking around the house and walking on the sidewalk up and down a little bit here and there. But I wanted to throw together this 30-day video because I've gotten some questions from a number of people on how things went pre-surgery and then post-surgery, and what all happened. So I'm going to go over that. I'm going to get my GoPro here, and I'm going to go show you some things that maybe you want to see how I did things, and then I'll go through the meds and some of the exercises that I did both pre and post. So my doctor was very thorough when it came to setting me up on a regimen here, and I'm still on a regimen. I'm now on outpatient physical therapy twice a week for the month of September. I'm recording this on September 3rd, which is 30 days post surgery. So let me get going and show you some things. Okay, so I wanted to share some other stuff as far as documentation, things I got in meds. So I'm going to go pre-surgery first, things I had to do, and then post-surgery. So first off, pre-surgery. Now, before my surgery, obviously, I went and got diagnosed by my surgeon, and we set up a time, and that was basically a 2-month advanced notice, really. I went to his office in, I want to say June, and we set the surgery for the end of July 25th, I believe, but things changed. He had to be out of town, so then it got moved to August 4th. In the meantime, when July started, July 1st, I started having to do exercises. And I've heard a lot of people, they don't get told to do pre-surgery exercises, which I guess it's up to your doctor. But I'm in the Baylor Scott and White. My doctor is Baylor Scott and White here in Dallas, and so they gave me a regimen of exercises that I had to do 3 times a day. So I was doing morning, afternoon, and evening. I would do these, and basically it was to strengthen the muscles around the hip that was going to be replaced, right? So it would make it a little easier to recover from. So, it was just leg lifts and things like that. I think I went over this in another video. And so besides the exercises, I had to go, and they gave me this nice little list. This is a patient pre-surgery to-do list. Very nice of them to do that. And 30 days prior to surgery, which was basically like around the end of June-ish, I had to get a preoperative clearance results required prior to pre-op appointment. So I had to go to my primary care provider and get blood work done, chest x-ray, EKG, and then a clearance letter from my PCP to the surgeon. And so I did that. I scheduled my appointment. It was like a mini physical, really. He took blood and they did all that, and they said, okay, you're fine. They sent a letter to my surgeon, so everything was good. I had to sign up for the Baylor Scott and White portal, which is where they send all the exercises I have to do and all the documentation that I have to read. A lot of documentation on how to do things, how to get out of the car, how to walk with a cane, how to walk with a walker. Just loads of documentation is put in there, and they give you tasks to do every day, as well as entering your pain. That's post-surgery, but entering your pain level. I had to, they say sign up for a joint replacement class, but we don't do that anymore. They basically put you on this Force Therapeutics application online website, and you learn everything there through videos and stuff. So I watched a lot of videos and read some documents on what's coming. Stop smoking, blah, blah, blah. I don't smoke. Make sure all dental work is completed 6 weeks prior. I hadn't any plans, so that wasn't an issue, but I have mentioned in another video that once you get a total hip replacement, pretty much, although my doctor said it's getting a little iffy, but right now you have to take antibiotics, even if you're going to go to the dentist for dental cleaning. you have to get antibiotics. And they said your dentist should prescribe those. If not, your primary care physician can maybe subscribe those. But I know I watched a lot of videos where people are going to the dentist office, and yes, they are taking antibiotics before they're cleaning. So just keep that in mind. And then also after the surgery, I cannot have any dental visits for 12 weeks unless it's an emergency. So I'm not don't have anything dental planned right now. So then continuing on, 2 weeks prior to surgery. 2 weeks prior to surgery, I have to stop taking all herbal and fish oil supplements. Well, I don't take fish oil supplements, but I do take glucosamine, which is a joint thing for your joints, aching joints. For us old people, we take glucosamine or some semblance to that. So that was 2 weeks prior. So I did that. 1 week prior to surgery, I stopped taking all aspirin, blood thinners, and NSAIDs. So I was taking 81 milligram aspirin. I stopped taking that. I was still allowed to take my lisinopril because I am a little chunky guy and I do have a little high blood pressure. Stop all weight loss drugs. I probably should be on some weight loss drugs, but I'm not taking those. And NSAIDs, I think, is ibuprofen. So I stopped taking any ibuprofen, PM, anything like that. That was taking for pain, really, at night. 5 days prior. So that 1 week prior, that's 7 days prior. 5 days prior to surgery, I start using Bactroban in your nose. So this is to kill bacteria and stuff up your nose. And Bactroban, if you're not aware, is really this. This is the prescribed mupirocin ointment. And basically it's just a little tube of paste. And I have a whole tube if anybody needs it. But every, I think twice a day, was it maybe? Yeah, twice daily. Take a cotton swab, put this stuff on it, and swab your nose for about 30 seconds. 5 days prior. So I don't know if your doctor's telling you to do that, but this is to combat bacteria and risk of infection. That's one thing. So I had to do that. This is pre-surgery. And then 3 days prior to surgery, I start using Hibiclens, or CHG, chlorhexidine gluconate. And I wash daily with this stuff. This is over the counter. You can buy it at Walgreens or CVS or whatever, and so for 3 days prior, including the day of surgery, that morning, I have to cleanse myself. First, I would wash myself, dry hair, normal soap I use, and then I would then go back and scrub my body with this stuff, and especially around where the hip was going to be replaced. I really had to scrub that a bunch as well. And this stuff, it makes your skin feel like you just got out of a shower with what is it, hard water, where you feel like the soap doesn't come off. That's what this stuff feels like. So I got a whole bunch of this, and I did use it after surgery. So after surgery, for the first, I don't know, a few days, maybe a week. First week, I was cleaning around the surgical area there, just for grins, I guess, because I have a whole big bottle of this. So Hibiclens, over the counter, probably like $10-15 a bottle. Yeah, it's expensive. So those were the 2 things I had to do pre-surgery. On the day of the surgery, so they called me a couple of days before, because they say, okay, your surgery's on August 4th, but we can't tell you the time yet. So a couple of days before, they call me and they say, hey, you got to check in at 8:30 a.m. downtown Dallas here. If you're familiar with Dallas Uptown, Baylor Uptown is where we went. Very nice facility, valet parking, free. So it was pretty nice. And then the anesthesia guy called me the night before, but I missed his call and tried to call him back. Couldn't get a hold of him. So we talked there in the room. And then do not eat after midnight the night before. So I didn't eat the night before. So on the day of surgery, shower with the Hibiclens, which I did. Do not use any lotions, body power, gels, hairspray, cologne, perfume, any of that. So no deodorant. I can drink a sugar-free Gatorade or water 1 hour before arrival. So I did drink some water, not much, no jewelry, and I showed up. And if you watch the video of the surgery, the room I was in, they basically, shaved the area, and the doctor came in. We talked a little. He wrote on what leg just to make sure they're operating on the right leg. And then the anesthesiologist guy came in and explained that they were doing just the normal, I guess, the gas here, but they were going to do a spinal. But they do a spinal thing. They insert in your spine there to basically numb everything from your waist down. And this helps with, I was told this helps with nausea. So they're right. When I woke up, I was not nauseous at all. I felt totally fine. I just, I was tapping on my legs. I couldn't feel my legs. But that wore off, after a bit. But so that was the surgery. I'd like to break in here before I continue with all the meds that I have to take for post-surgery and address one question I got was, how did I get in the car after surgery? Well, before I could leave the hospital, I had to walk around the floor, which I'll get to later in this video, and I had to walk up and down these, three stairs and back up and down, and they wouldn't let me leave until I could do that, and also wouldn't let me leave until I could relieve myself, which basically I had to piss in one of those portable urinals. And so I did all those three things, and I got dressed with my shorts. I had loose shorts and almost a t-shirt like this, really loose shirt. They gave me some socks, or actually I was wearing the socks that they gave me. They put these on you to keep your feet cold. These are not compression socks, but I was wearing these. I get to keep these for whatever. And they put me in a wheelchair and they wheeled me downstairs. Meanwhile, my wife went downstairs and got the valet to bring the car up. The car that we have, I borrowed my mom's car because it's much bigger. It's a Ford Taurus. My wife drives a little Acura deal and sits way low to the ground. So the Ford Taurus was a big four-door car. Before going for the operation, we kind of tested the things, and it seemed to better for me to get in the car was to take the front passenger seat and slide it all the way up as far as it could go, which was quite a ways, and then the back door to the back seat was much bigger than the front door seat, if you ever look at a Ford Taurus. And so I had much bigger opening to get into. With the front seat pushed all the way forward, I had, ample leg space. So I would got out of the wheelchair, and the nurse kind of helped me hobble over. I didn't have my cane or walker or anything like that. They wouldn't let me take a walker home, which I complained to them about that. I was supposed to get a free walker. And then I back up to the back of the car, and I put my, hands on the back seat there, and I kind of just slide my butt in. I took my left leg, which is a good leg, and put it into the back seat. And then the nurse and or my wife, I can't remember, basically helped me lift up my operative leg, which was basically dead meat, right? The muscles, none of that was moving. So I had to pick that up and put it in. And like I said, I had ample space. Didn't have to worry about this 90 degrees deal or anything like that, really. They just said, just don't overdo that. So I was sitting just normal. I don't think I was leaning forward. Just don't lean forward, I guess. So I was sitting normally, and unfortunately, when I got let go of the hospital, it was rush hour in Dallas. And so we had to drive from downtown Dallas back up we live in the suburbs, northeast suburbs of the Dallas-Fort Worth Metroplex. And it was an hour-long drive. But, it was okay. I still had whatever they shot me up with for the pain and anything. I didn't feel any pain. Nothing at all. So it was just a long drive home. And got home and had my hospital bed and went on from there. So I just wanted to address how I got into the car after surgery. So post-surgery, I had already collected all my meds. I had a prescription from a nurse from my doctor's office, a surgeon's office, and they had, let me count here, 1, 2, 3, 4, 5, 6, 7, 7 prescriptions I had to go get and pay, which wasn't that expensive with my insurance. I have Baylor Scott and White health plan as well, so that kind of helped out. But I'll go through each one of these. So number one, this ondansetron ODT. Now, this stuff is tablets, and this is for nausea. Didn't use it. Didn't need it. I got a whole thing of it. I guess I could use if I ever get nauseous, but didn't need those. Hydrocodone. Super duper pain relief. Then you have tramadol. Super duper mid pain relief. Then you have diclofenac. Pronounce that right, diclofenac. This is kind of like an ibuprofen pill. So they tell you do not take ibuprofen if you're taking this. So that's what that is for. Tranexamic acid. This is for, and I take this for 10 days. This is only 10 days. Reduce post-operative bleeding. So took all this. These are all empty now because I exhausted them. I have one other prescription that's not here, but it was 81 milligram aspirin. Even though I already had some aspirin, they prescribed it some more, and I'm still taking those. You take those for 30 days, twice a day, for blood thinner to make sure you don't get any clots. Which comes to remind me one more thing I did buy for post-surgery. Compression socks. You're going to have compression socks. You got to wear them. Recommendation from my doctor was wear them every day, and then you can take them off at night. So that kind of keeps you from getting blood clots down there. And then that combined with the exercises you're doing with your heels and things like that, it helps alleviate any attempts at blood clot. And then one other thing was they gave me this at the hospital. So this isn't really a prescription per se, but it's Nozine nasal sanitizer, and it's very much like the back-to-band stuff. It's very much like this as far as what it's for. Put it on these Q-tips that were provided. Swab your nose. And again, this is just to keep the bacteria down so you don't get infected. And they say bacteria, the worst places are your nose and your mouth. So keep those clean, and things will go good. I've shown a couple of pictures of my scar as it's gone along the way. I might take one here and share it here, but it's looking pretty good. Everything's moved along. Mesh has been removed. It's I wash it as normal today, so no things there. So that's those are all my meds I'm taking post-surgery. I had a schedule. And here's the list. They give you my doctor gives me this big old list for after surgery medications. They tell you what it's for and how long you're supposed to take it, and really the prescription kind of covers how long you take it. And then they do a recommended thing here. And for pain relief, there's Tylenol. I forgot to mention, but there's Tylenol, extra strength Tylenol included in this. And so if your pain is probably like a 3 to a 5 level, which I was probably a 5. I don't think it may have jumped to a 6 once, but other than that, it was mainly a 5. And then it's just like today, it's probably a 1 or 2 at most. But I put together a schedule where I would take hydrocodone. So you would take these, like this hydrocodone is 1 tablet every 6 hours. Tramadol, 1 tablet every 6 hours, 6 to 8 hours. Tylenol extra strength every 6 hours. So I would stagger those. I would do hydrocodone. 2 hours later, then I would start with a tramadol. 2 hours later, I'd take a Tylenol extra strength. 2 hours later, now I restart that hydrocodone, and so on and so on. And I did that for 7 days. I had 7 days worth of narcotics. So those first 7 or 8 days, I was using the narcotics, and whether I need them or not, I guess I went ahead and took them. And so now I just take Tylenol, extra strength Tylenol. I haven't taken any today actually, but I normally take it around noon, and then right before I go to bed, I'll take a tablet just to kind of take the edge off. So that's post-surgery. Like I said, my doctors, they're very attendant with me. With the app that I use, they use the 4-Star Therapeutics app. Before I could leave the hospital, I had to, if you watch that video, you see that I had to walk upstairs. I had to walk around the floor there. And then my physical therapist there gave me these list of exercises to do, which I did. All right, so here I am. I am currently upstairs, which that was a big deal. Making it up the stairs took about a week to do that. I'm walking with my cane. Here you go. Had to buy that extra end because of the it was a little unstable. This allows me to just set it down like that and grab it. Post surgery, I was using, and I don't really use it now. I kind of use it like a walker in the shower, but there's the shower chair that I was using and still kind of use, but I really just take showers normal now. That toilet chair, which was downstairs, I bought one that you could move between toilets, so that you know, I didn't have to unhook one and put it up here. This toilet seat works really good if you have the oblong toilet like that. Downstairs we have more of a circle one, so it's kind of sketchy on the front there. But this worked really fine, and I'm still using it. Although occasionally I'll take it off and I'll put it down. But it does give me a, you know, you can see there are a few inches of height still that is right now comfortable still to me. One other thing that I have used, but not extensively as I thought I would need it, was this right here, this little grabber guy. It is helpful, and I'm still using it actually right now to put on my undergarments. I'm not to the point where I can stand on one leg and lift my leg and step through shorts and undergarments, so I'm still kind of using it for that. This is a nice one from Amazon. It does, break down like that. So again, one of those post-surgery deals that a lot of people recommend. So a couple other items I wanted to point out. I don't have the hospital bed anymore, but we actually rented a hospital bed for 4 weeks that allowed me to stay downstairs. I didn't have to go upstairs to my bed. At least the first 3 weeks I was in the hospital bed, pretty much down here all the time. It was one that raises your head, and it allowed me to do a lot of things as far as exercises and knees. So I'll put a picture of that here as well, but it was pretty cheap, $200 for the month to rent a hospital bed, fully equipped deal. In addition, we went and bought this sliding table, which allowed me to, at least for the first week and a half, do my meals, do my finances, things like that, pay bills, all right here from the bed. And then, of course, I had this walker, which is now stowed away, but my super blue walker that I'm not using anymore. So it basically folds up like that. And like I said, I only used it outside the house once, and then I used it once to go to physical therapy outside the house last week, and then I haven't been using it since. And then another very crucial item that I used extensively the first week is this thing. Yep, that's what it is. It's a urinal, and when you wake up in the middle of the night at like 2-3 a.m. and you have problems getting out of the bed because of your hip, well, this was definitely helpful. So I would recommend this if you're a guy anyway. Or if there's a female alternative to this, I'd recommend that, because if you're like me and getting up in the middle of the night, it was tough sliding out of the bed and remembering you got bad hip and all of that. So definitely recommend getting you one of those. And now I am on outpatient physical therapy. Before that, I was on in-home physical therapy. The lady would come twice a week and basically beat the hell out of me. We do the exercises in the bed. I do those things, and then I have to stand up and do the hip extenders and all of these, and then I'd walk around my kitchen area like for 6-7 minutes until that was done. And then the last week that the in-house physical therapist came, I basically we walked outside, went down a couple of houses, and came back. So, and I'm on, this is week 5, 30 days out, week 5, and I am doing outpatient physical therapy. I just went to my second one yesterday, and I got another one coming this coming Friday. And again, it's just doing the exercises that I was told to do by the physical therapist last week when I met. And I just do those and walk. And trying to strengthen the leg here. When I go to physical therapy now, they put me on the machines where you push back and forth to try and build strength in this leg. And then I kind of get through these kind of parallel bars and kind of walk on things and try to build up confidence and get my balance back. Things were pretty good. I mean, I have never been in severe pain. I've heard people say that it's very painful. I didn't have any pain. It ache? Yes, it aches. But the pain, not there. The pain before surgery, that was painful. The hip, bone on bone, affected my back. My back was just in severe pain all the time. I have no back pain. I have backache now because I'm learning how to re-walk, because I was walking hunched over and I was hobbling. I was basically limping because of the hip. And so I'm relearning how to walk. My doctor said he gave me a 20-year-old hip, the hip of a 20-year-old, I guess is how you say it. And he wants to take care of my left hip because my left hip is also hardly any cartilage, if any, left, almost pretty much bone on bone. But it doesn't bother me as much as the right hip did. It's definitely not as painful as the right hip was. In October, I had to make a decision on the left hip if I want to get it done this year. And the only thing about that is if I can get it done in December, my deductible's already paid, so it's basically a free total hip replacement. So if you have hip pain and you're on the fence, like I was for quite a while, I should have got this done back in January, February, and I would have enjoyed my summer. But if you're on the fence to do this, I would say do it. I don't know how your surgeon is, but my surgeon was great. Here, if you're in Dallas and you need a recommendation, just hit me up and I'll give you his name. He works out of the Baylor Scott and White up here in the Garland Richardson area, if you're familiar with Dallas. And then he operates out of two hospitals, the Baylor Uptown, which is basically downtown Dallas, or there's one Baylor up here in Plano. So just let me know. I'll let you know. He's great guy. I think that's everything I can share with you right now, and hopefully you catch back up with me in a month and see where I am, or follow me and see, oh look, Chuck's fishing. He must be doing great with his hip, or he's riding his bike. Look at him, he's riding his bike. Then you'll know things are going good. Thanks for sticking with me this far, and those of you who are scheduled for surgery, and I know there's a couple that were asking me questions, good luck with your surgery. Ask questions. Make sure you're getting all the care that you need and are paying for. I can't tell you how good, the Baylor Uptown staff there, the nurses were wonderful, the PT guy, wonderful, the anesthesiologist, wonderful, great people. They care about you. That's all I can say about them. I recommend. So thanks for watching. See you in the next video. This is Chuck. This is Retirement Ain't Easy. Peace.